Okay, so let's have a little look into this question here. Should I use sleep medication? So yes, obviously sleep medication, it's well used, and quite a lot of people depend on sleep medication, and it's certainly not there for the long term. It's more so for short term use. And we need to actually start covering what the dangers are with using sleep medication. It does seem to be often overlooked. So one of the most prevalent negative impacts of sleep aids, like for example benzodiazepine, hypnotics, and you have zopiclone, is we have these hangover side effects from them, and undesired side effects such as tiredness. You have balance issues, poor motor coordination, memory issues, cognitive problems. 80% of people who actually is prescribed sleeping pills say that they experience at least one of these in the next day. And look at all these, look at all this that comes with, like weakness, diarrhea, nausea, gas, headaches, constipation, changes in appetite, dizziness, balance issues, shaking, nightmares, stomach pain, drowsiness. I think you get the picture. And a frequent user of sleep medication can quickly get accustomed to these drugs as well, and then they become less effective because we build a tolerance. And this can result in dependence, meaning that your body is so used to you taking these pills that falling asleep without the drugs become even more challenging. So you're actually making it worse. So just bear that in mind. Withdrawal is also something that comes along with it. This means you experience really uncomfortable symptoms such as shaking, sweating, and nausea. Quite intense. So some people start mixing even sleep medication with alcohol, which is obviously a sedative in itself. And the pairing of these two poses a severe risk, and it can cause your breathing to become so slow it can result in death. Then you have parasomnia, and it's a type of sleep disorder that causes unnatural physical occurrences or experience that keep you awake all night, and I can only imagine it'd be absolute hell. And parasomnia can happen even before, during, or right after waking up from your sleep. If you suffer from parasomnia, you might act strangely, you move and talk abnormally, or express your emotions in odd ways. Sleep, talking, eating, and driving and walking are the parasomnias that most frequently are linked to sleep aids. Increased dosage may make these behaviours even more frequent. And according to research that's been published in 2018, hypnotics, they are connected to major illnesses and untimely deaths from cancer, serious infections, mood disorders, injuries, suicides, and even homicides. And two additional studies have connected Zolt, hopefully I'm pronouncing this right, Zolpidem, and this has been used, and it's actually been shown that people who use this has shown suicidal behaviours perhaps during sleep as well. Some groups of people are at higher risk of developing certain side effects, and these groups include people with liver and kidney diseases. They may be pregnant or breastfeeding women, or older people with chronic lung conditions, like for example asthma, chronic obstructive pulmonary disease, and people taking other drugs can negatively impact with sleeping pills. You have the interactions there as well. Move my head over a little bit. So if you do experience mild or severe negative side effects, make sure you're talking to your doctor about this, and make sure you tell me about this as well. They might recommend a lower dose or alternative prescription, or a strategy to try and help you come off the prescription. So I think you get the gist here. I'm strongly need to watch what I'm saying here, but I would strongly recommend you trying all the holistic ways first, and obviously if that fails, you need to maybe look at medication. But just be wary if you are going down the medication route, that you make sure it's being, once prescribed, it's being monitored. Make sure you even be proactive and book GP appointments, etc. But we're here to attack like just mild sleep problems here. If it is severe, you need to let me know and I can help you with that. Okay, so hopefully hopefully this was beneficial. I thought it would be important to just to present the dangers of taking medication. Don't jump into it straight away, and I want you to just try and ingrain this habit where you're doing your meditation, you're creating this hygiene environment where it's allowing you to relax and try all these natural things first, because that will, it's so effective. You don't need medication. Some people do, but if you go through all these and you make it a habit and habit and habit, and you're doing everything that I'm asking you to do, you are going to have better quality sleep, and that's the goal here. And there's obviously reasons that we've talked about in terms of why it's so beneficial for you. So that's that. What I'm going to move on to now is jet lag and shift work, because obviously this is a common problem that people face when they're doing shift work or they're travelling a lot. So definitely want to go over that in the next module. So hopefully this is helpful. Any questions? Give me a shout. Thanks.